Hi, Dr. Patel.
Hey, Dr. Maura, how are you today?
I'm good. Thanks for joining me. We're going to talk about
Yeah.
bloating today. Something
Oh,
many
fun.
of our patients come in with, right? Our favorite topic.
Big
Big
symptom for
symptom.
sure.
What causes bloating?
Yeah, typically when I think bloating, and again, everybody's different, but I want to investigate stress, food sensitivities, chronic infections, whether that's, large or small intestine. And we do different sorts of investigation to find those kind of answers.
Great. Yeah, something's going on there. Something's pinging the gut. And so what kind of, ways do we investigate? What do you typically think of right off the bat?
Yeah, typically I want to think about food sensitivity testing, which is a blood test. We want to do breath testing for an official SIBO diagnosis. SIBO stands for small intestinal bacterial overgrowth, to see if that's happening.
Hmm.
At home stool testing to look at microbiome overall. And then I forgot to mention hormonal imbalance. So looking at parent hormones and testing hormones or hormone metabolism and see how things are detoxing through the body. And
Yep.
so getting that kind of information to target our treatment.
Yeah, so key to individualize
Mhm.
treatment. And so speaking of treatment, where do you usually go with treatment?
Yeah, I typically I'll use food as medicine, obviously. So doing some nutritional changes in addition to lifestyle, in
Mhm.
addition to perhaps supplements and herbs to help with whatever's going on, whether it's an infection or hormonal imbalance. So targeting that treatment
Mhm.
with natural medicine.
Motility issue, right? One of the big things we see with connected to gut
Hmm.
issues in SIBO, where gut moving too fast or too slow, adjusting that make a big change in bloating.
Absolutely. Yeah, when we think about just sluggish bowels, constipation, whether that's an IBS picture also, or IBD with a Crohn's or
Yeah.
colitis and autoimmune situation. So really just, again, individualizing because everybody's so different there.
So many pathways, but it's treatable, right, Dr. Patel? I mean, this is not something
Hmm.
people have to live with, right?
Yeah, and it's oftentimes one of the main things I treat because it's just so common,
Yeah.
but it's not technically normal. It's a
Yeah.
sign of your body's trying to tell you
Speaking
something,
to you,
and,
right?
and
Exactly.
we really want to figure out what's going on.
Yeah. Cool. Thank you.
Yeah, thanks for having me.